Today, polling has revealed that 85% of voters thought the government was handling the NHS badly. This comes after record-breaking hospital waiting lists and ambulance delays have affected people across the UK. Reports have also revealed that 50,000 more people than normal, yes, we're not going to stop talking about it, have died in the past year. The National Health Service is at breaking point, and who is to blame for this? Here to discuss this with me is former Non-Executive Director of the NHS, Graham Smith. Good evening, Graham. How are you doing?
Not bad. How are you?
I'm worried about this public confidence in the NHS. What's going on?
Well, I think the public are quite right to be concerned about the NHS, but the problems with the NHS have only been exacerbated in the last couple of years by COVID. The problems with the NHS are deep-seated and are the problems that you find in all institutions in the country at the moment. At the moment, equality of outcome is the paramount importance to all people within the NHS. All power has been taken away from people, from patients. The NHS talk a good game about providing patients with choice, but patients don't have any choice. And anyone who has had the misfortune of having to deal with NHS A&E or GPs over the last few months can provide good evidence towards that.
But there was an interesting bit in the in the story that said those that had actually experienced the NHS recently were quite confident. OK, yeah, so those who'd used health service were more likely to be satisfied with the care they'd received than unsatisfied if they'd actually used it. 63% versus 32%.
Yes.
So, look, I think we all agree that the NHS, all's not right in the NHS.
Yes.
But, you know, we've got to put some support and love towards these people that are working their beeps off every day for us lot.
Yes.
You know, I've never had, for example, a bad experience in the NHS.
No.
In fact, I've had completely the opposite almost every time.
Yes, I mean, well, of course, everyone's experience will be different. I would say 63% is not a particularly high number. So 4 out of 10 people who are using the NHS aren't having a good experience.
Conservatives wouldn't mind having 63%.
Well, no, absolutely. And it's very easy to trash the NHS. And the NHS is full of good people, well-meaning people. I think that the NHS, the problem is more cock-up as opposed to conspiracy. But a lot of money is chucked at the NHS and people do deserve better. People do deserve to get better outcomes. We lag behind most Western countries when it comes to cancer survival rates. As you mentioned earlier, 50,000 excess deaths. That really isn't good enough. COVID, I left during the COVID pandemic. I was horrified by some of the decisions that were made during that time. It seems to me that if you had an illness that's to most people would seem much more serious than COVID, such as cancer or heart problems, that you had to take a back seat while everyone stayed at home and the NHS tried to solve.
That was a government policy, wasn't it? So we can't blame the NHS for that.
Well,
it feels like we need a new beginning in some way.
Yes.
And there's a lot of people with a lot of views on this. What would a new beginning look like for you? Would the pay dispute being settled be a good start?
I think if I could change one thing about the NHS, and it will never happen because it's enshrined in law, all NHS money is public money. I don't see why you can't combine public money with private money and insurance money. There seems to be three sources of, 3 ways you can fund a nation's healthcare, and we decide as a nation to only use taxpayers' money. The second thing I would do, if I was to have a second thing, I would give more choice to patients. I would allow patients to have a choice about what GP services they use, and if you allow patients to have more choice, you create competition, and creating competition creates better services in my mind.
I'm sympathetic to what you're saying in terms of the fact that because the NHS is ultimately a socialist model, isn't it? It is a socialist model. It is equality of outcome.
Yeah, absolutely.
And you know, as in all socialist models, you pour a huge amount of money into it and nobody gets anything decent out of it.
Yes.
But I think to humanise the frontline worker...
Absolutely.
My personal view is I have this sort of fantasy in my head that there is some manager somewhere who hasn't done a day's work in 5 years who's still picking up a cheque from the NHS.
Yes.
I feel like we should recall all of them to London who aren't doctors and nurses and surgeons and ward sisters and all of this. Anyone who's in an administrative role and get them to re-explain what the role is to us.
Yes.
And then if it's not needed, sack them and give the money to somebody else.
Yes. I mean, I've worked with a lot of NHS managers, and they're all well-intentioned, and they're all good people who think they're doing good things. And indeed, the NHS actually spends less on management compared to other sized companies. I mean, the NHS is a monolith with over 1 million workers. Actually, the percentage it spends on management isn't that high. I think it's more the ideology behind the managers that creates the problem. It is a left-wing collectivist idea that permeates all parts of the NHS. But it's not just the NHS. You see it in other walks of life in the public sector as well. So I would... the NHS is very much a top-down organisation. You should be made a bottom-up organisation. The way you do that, and to be fair, the Lansley reforms under David Cameron, they did try and do that. They failed, and it hasn't succeeded. But the aim has to be to give patients more choice. They talk about choice, they talk a good game about choice, but they don't see that if you give people choice, people are going to make different choices, and then you're not going to have a quality of outcome. We have to accept that people are going to make different choices and they're going to be worse outcomes because of that.
Well, there we are. It's kind of ironic because it's like power to the people.
Yes.
You know what happens to the people that say power to the people? They're doing the other things. Anyway, thank you so much for joining me.
My pleasure.